Hi guys, I'm your favorite Talented, or you can call me the Sweet Mouners. If you're a first timer here, you're welcome. We're all about health, we're all about health education, we're all about nursing, vlogs, and what about you? Please feel free to hit the subscribe button and also the notification bell button so that you get notified anytime I post a new video. And if you're a return subscriber, you're welcome. You know I love you. So today we're going to be doing a video on ulcer, specifically peptic ulcer. So please stay with me, guys.
Like I said earlier, our topic for today is going to be peptic ulcer. According to WHO, out of every 1,000 cases you get in the hospital, one person is suffering from peptic ulcer, and globally, there are 8.9 million people suffering from peptic ulcer. There are actually a lot of misconceptions about peptic ulcer concerning the causes of peptic ulcer and some of the ways to prevent peptic ulcer. And so I'll be dealing extensively but briefly on the topic peptic ulcer today. So first, before we dig in right into the topic, let me give a brief overview of the gastrointestinal tract or the alimentary canal, which is also called the digestive tract. The gastrointestinal tract is made up of the mouth, made up of the esophagus, the stomach, the small intestine, and the large intestine. This put together is what makes up the gastrointestinal tract. So what happens is when you eat, when you ingest food, the food passes from the mouth to the esophagus and from the esophagus into the stomach. The stomach makes an acid that mixes with this food to help the food digest. And this acid is called the digestive juice or the hydrochloric acid. The stomach, which is the temporary reservoir where food are stored temporarily till it is digested, is made up of 3 layers, and those layers include the muscular layer, the submucosal layer, and the mucosal layer. The mucosal layer is the innermost lining of the stomach, and this is one of the factors that prevents the stomach from ulcer. It prevents the hydrochloric acid from burning deep into the stomach. It's one of the preventive factors of ulcer. Now, how do ulcers happen? Ulcers are caused when there is an imbalance between the digestive juice produced by the stomach and various factors that protect the lining of the stomach. When there is an imbalance, the digestive juice erodes the mucosal layer. That's there's an erosion of the mucosal layer. Just like when you have bruises and the upper part of your skin, that's the outer epidermis, is slightly scraped off. That same thing, similar thing that happens in the stomach when there's an imbalance between the digestive juice produced. Now we're going to be discussing the causes of peptic ulcer. There are few causes of peptic ulcer, although there are various misconceptions and superstitious belief of the causes of peptic ulcer. But the first cause we'll be considering today is the Helicobacter pylori. This is the microorganism that is responsible for causing ulcer. I know a lot of people say it's starvation, is because you're not eating, that's how you get ulcer, and a lot of other reasons people gave themselves that is the cause of ulcer. But one of the major causes of ulcer is Helicobacter pylori. That's why when you go to the hospital with symptoms of ulcer, you're asked to bring a stool sample that a test will be done to determine if there is presence of this bacteria in your stool or not. So this is the number one cause of ulcer. The second cause we'll be looking at is alcohol consumption. What alcohol does, or the role it plays in causing ulcer, is, like I said earlier, ulcer are caused when there is an imbalance between the digestive juice produced and various factors put in place to protect the stomach lining. When you consume a lot of alcohol, it increases the production of digestive juice, which is hydrochloric acid. And once the production of this acid is increased beyond the point it's supposed to be, it causes erosion on the stomach lining, which then causes ulcer. Another cause of ulcer is medications such as NSAID. NSAID are non-steroidal anti-inflammatory drugs. An example of this category of drugs is the aspirins, ibuprofen, diclofenac. So how do this drug cause ulcer? There is a lining, one of the lining factors that prevent ulcer in the stomach. It's called the prostaglandin. What does prostaglandin do? Prostaglandin inhibits the hydrochloric acid secretion, and it also stimulates the mucosa secretion. So what prostaglandin does, it tells the acid when to stop producing acids and tell the mucosa when to start producing mucus. That is, if the acid is becoming too much, it stops the acid production and stimulates mucosa secretion. But when you take too much of NSAID drugs, or you take them without prescription, or you're on them for a very long period of time, they inhibit prostaglandin. That is, they stopped prostaglandin from doing their work. So there's every possibility that if the prostaglandins are not active, the hydrochloric acid will continue to secrete and secrete without having anything to actually tell it to stop. And when there is excessive secretion of this acid, it leads to erosion of the mucosal lining, and then we'll say one has ulcer. Another cause of peptic ulcer is stress. Although a lot of studies argue that stress is not a direct cause of peptic ulcer, they said stress ulcer is different from peptic ulcer, but stress tends to increase the occurrence of peptic ulcer. So most times what happens and how stress increases causes of peptic ulcer, it's actually psychological stress and stress from other inflammatory processes that increases peptic ulcer. The next cause we're going to be looking at is caffeine. Whether a coffee is caffeinated or decaffeinated, it increases the production of hydrochloric acid. And from what we've explained earlier on, when there's excessive secretion of hydrochloric acid, it will erode the stomach lining and then causes ulcer. The next causes we're going to look at is cigarette smoking. One of the ways cigarette smoking causes ulcer directly and indirectly. It causes ulcer directly by having an effect on gastric acid secretion, and once gastric acid secretion is affected and not regulated as it should be, it causes ulcer. And the indirect way cigarette smoking causes ulcer is, one of the side effects of cigarettes is reduction of antioxidants and reduction of the body defensive immune. Once the body's defensive immune is reduced and antioxidants are reduced, the stomach is prone to infection of Helicobacter pylori, which we said was the number one and major cause of ulcer. So this is how cigarette smoking causes ulcer. So outside these causes mentioned, it's also said that family history can also be included as one of the risk factors for peptic ulcer, meaning you have higher chances of having peptic ulcer if members of your family or you have a family history of peptic ulcer. So now we'll be talking about some of the signs and symptoms of peptic ulcer. If you're still watching this video to this point and you're yet to subscribe, please do subscribe, hit the notification bell button so that you get notified anytime I post a new video, and please do well to like and share your comments about this video. So the first signs and symptoms we'll be seeing here today is epigastric pain. That is pain on the upper part of the abdomen, just below the ribs. And this pain is usually experienced few minutes to probably an hour or two after meals. And sometimes this pain radiates to the back. So this is the first signs and symptoms of peptic ulcer. The next signs and symptoms we're going to be seeing is heartburn. This is like a burning sensation on your chest. Some people will describe it as probably feeling something peppery on an open wound. And then also the next signs and symptoms we're going to be looking at is poor appetite, or we could say little appetite or no appetite for food at all. That's on other signs and symptoms of peptic ulcer. Other signs and symptoms of peptic ulcer includes burping and also feeling bloated. That's bloatedness of the stomach. If you have any of these symptoms, please do well to see your doctor for a proper diagnosis and prescribe the medication. Ulcer that is left untreated can be harmful because it can lead to internal bleeding, it can lead to intestinal perforation and also death. So please do well to see your doctor if you have any of these symptoms. Please, if you're yet to subscribe, do well to hit the subscribe button, and if you're enjoying this video, please just give us a thumbs up and leave your comments. So what's my advice on peptic ulcer? My little advice for those who have peptic ulcer: first, I would say you take small regular meals, about 5 meals per day. You take it at interval to avoid being too hungry and excessive secretion of gastric juice. And also, you should try as much as possible to avoid spicy food, especially Nigerians. Please avoid very spicy food and very peppery food. And then you try as much as possible to avoid all the causes of peptic ulcer that I have mentioned. Avoid cigarette smoking, caffeine, alcohol, and all of that. And also, another advice for people: if you're a known peptic ulcer case, please avoid chewing gum on an empty stomach. Chewing stimulates digestion. Once the mouth perceives that there is chewing, it produces hydrochloric acid in preparation to digest whatever food is being ingested. But in the case of chewing gum, there is no food actually being ingested, so there's just production and production of hydrochloric acid, and this hydrochloric acid in turn erodes the stomach walls. So please, if you have ulcer or you're a known case of peptic ulcer, please avoid chewing gum on an empty stomach. And it also applies to everybody. I feel it's also a risk factor when you chew gum on an empty stomach. And this will be the end of the slide. Thank you.
So that will be all for now, guys. I hope you learned something new, or there's something you actually did hold on to from this short video. Please, if you have any question, feel free to drop it in the comment section. And if you're not so convenient to dropping it in the comment section, you can always send me a mail or send me a DM on my social media handle as North Talented. It was nice having you guys. Bye. See you next time.